If one of your goals this year is to achieve a more youthful appearance, certified physician assistant Danielle Moser from Maloney Plastic Surgery joins us to explore the myths and the truths about Botox. Ms. Moser, thanks so much for joining us today.
Thank you. Thank you for having me.
Pleasure to see you. So Botox, I mean, it's been around a long time. It really has so many uses that, we'll sort of dive into, but let's tell folks what Botox is exactly first.
Okay, well, Botox is a wonderful product that's been on the U.S. market for 15 years now, and it's just a purified protein that relaxes the muscles it's injected into. It lasts 3 to 6 months, and how you look after Botox is how you look when you're relaxed, plus a little extra softening of the lines.
Right, and after a while, you keep that young look about you, which is what everybody wants these days. And so anybody really a lot of people are candidates. I shouldn't say anybody, but run us through some of the folks who would be.
Yes, so it's used in both males and females, and it's FDA approved for ages 18 to 65. And that being said, I do many patients over the age of 65 that are very happy with the product. It just hasn't been tested over that age group.
Right, wide-ranging group of people that can benefit from this, like I said, for all sorts of uses. But the tests you use to determine this, when someone comes into your office and they say, am I a good candidate for Botox? First you look at the age range, but then you look at some other things, right?
Yes, actually I can pretend you're one of my patients that came in today. And so basically I talk to them about what the product is, and then I walk them through a little series of animation with their face to see if they might be a good candidate for this product.
Okay.
Because Botox is especially useful for dynamic lines, meaning when you move, if these lines come in, then you're probably a good candidate for the Botox. So one of the things I'll have my patients do is frown.
Okay, let's frown. Let's see.
See, and if we get a little bit of that look right in through there, we can soften that look with Botox and make it so that you can't really squint through that area.
Got it.
And then we have you raise your eyebrows up, and we can take care of those horizontal lines on the forehead as well. And then last but not least, we have you do a big smile, and if we get a little of the crow's feet coming in, we can soften those lines also.
Excellent.
And it's important to kind of start when we're young, because we can actually prevent those lines from setting in and etching into the surface of the skin, which is everybody's goal.
Got it. So would you say I'm a candidate?
I think almost anyone is, but yes, we can certainly soften that look and kind of give you a more well-rested look, which is what we're going for.
Excellent. And so once you get injected with Botox, once you have the treatment, how long does it take so that you see results?
So Botox is not immediate. It takes about 5 to 7 days to set in. And likewise, as it lasts for 3 to 6 months, and as it's kind of running out, you just slowly over the course of a week kind of go back to the way things were before, and then it's time to come in for your next treatment. So most of my patients will schedule right at about the 3 to 4 month mark.
Okay, and any side effects that people should be looking out for or concerned about?
Some of the most common side effects are just pinpoint bruises in the areas of injection, and usually right after treatment you'll have a little bleb on the skin that lasts for about 15 minutes. Bruising is not even looks just fine right afterward. Most patients don't even have much of that going on. So it's pretty easy to use. The treatment takes about 15 minutes and you're in and out of the office.
And we're seeing some of those before and afters there, and it just sort of underlines the fact that it's both for men and for women, that large age range that you talked about. And long-term use, let's talk about that. Any concerns if somebody does this over a period of, say, 10 years, 20 years?
Absolutely not. So actually Europe has studies that go out for about 30 years, and they're not seeing any negative side effects over the long-term use of this product. And we've had it on the U.S. market for 15 years. Patients are enjoying it every 3 months, and we're not seeing any detrimental outcomes from that. And likewise, we're seeing a large increase in our male population using Botox over the years. I'd say about 30 to 40% of my patient mix is male, because they're also really enjoying this well-rested look. A lot of my patients are businessmen that want to look more rested for their jobs.
Absolutely. I mean, the impression you give somebody when you first meet them, it's the smile, it's your face. If you look well-rested, they're going to want to do business with you. You're going to seem like more of an awake, maybe trustworthy person. I know that sounds kind of...
It's absolutely correct.
It's true, though. But, as far as if someone, there's many different types of different types of services that people can have for their appearance, different types of procedures. How does someone know that Botox is the right choice for them as opposed to others?
Absolutely. Well, you certainly need to come in for an evaluation. And I tell patients that if when you talk or chew or move the face, these lines come in, then probably will apply Botox to those areas. But if you're at rest and we see a little line and we need to actually lift that line up in some way, we use fillers. So it's very important to come in. It might be a combination of treatments, or maybe it'll be just as simple as 15 minutes worth of Botox and you're out the door.
Well, and what's amazing about Botox too is it's not just your appearance, it has a lot of other medical uses too, that maybe you can address some of those.
Yes, absolutely. So originally, one of the ways we discovered that Botox would be great for cosmetic use is it was being used in children with hemifacial spasms. So they were spasming on one side of the face, and they would receive Botox treatment to that side of the face, and it would help relax it. And they were noticing that as these children got older and they still required the Botox treatment, it was starting to age. The one side of the face that wasn't treated was aging normally, and then the other side of the face wasn't receiving the same aging process. And so they decided, why don't we use some of this great stuff for cosmetic use and the anti-aging process?
Right, so it's good for kids. You mentioned also earlier underarm.
Yes. So one of the beautiful uses, it's FDA approved for hyperhidrosis, which is excessive sweating. And so we actually apply it to the underarm area. It's an amazing treatment. So you get to go almost 6 months without any sweating under the arms. And that's wonderful for businessmen and women, and also for just anybody who really can't stand it. Here in Arizona, I love having that treatment every 6 months.
Absolutely. So many uses for it. Maloney Plastic Surgery is where you want to go. You want to see Danielle Moser. She'll really take care of you. And Danielle, as always, thank you so much for joining us.
Thank you so much for having me.
Of course. Now, as a special offer, mention this Morning Blend segment to get $50 off your first Botox treatment. Call 520-298-2330 right now to make an appointment. Or for more info, you can email dmoser@acssurgeons.com. Now, later in the show, we continue our focus on health with an expert in getting rid of your pain. Stay tuned for the science behind something called kyphoplasty.